We're speaking with Jennifer Covich Bordenick, Chief Executive Officer at eHealth Initiative in Washington, D.C. Jennifer, thank you very much for agreeing to speak with us today.
Thanks, Mike. It's great to be here.
Can you first explain to us what eHealth Initiative is?
Sure. We're a nonprofit organization in Washington, D.C., and our mission is to use technology to improve the quality and safety of healthcare. So we've got about 220 of the key influencers in health information technology and provider groups organized to help advocate for HIT and to help improve quality. We do a lot of education and awareness.
So how do you get your view of the industry then? How do you receive the information that you're reviewing?
We've got a pretty diverse constituency, so it depends on who you're talking to. So what we get to do is we hear it from all sides. We hear it from providers, consumers, payers, from the vendors, what are the issues going on out there. And we also have about 250 communities around the country that we meet with on a monthly basis to hear about how are they connecting, what are the types of technologies that are working, what are the challenges and the issues. So we get to learn a lot about what's actually going on in the field, and we're a connection for many people who want to understand the field better.
I see. And this is a nonprofit organization. How long has it been in existence?
About 10 years.
10 years?
Yeah.
Are you involved at all in what's happening in Washington right now?
Absolutely. We've got a lot of close ties to many folks in ONC and HHS. Many of them used to work at EHI, so we're fortunate in that way. And we're pretty well connected with the policy community there. We've got a very active set of advocates and policy members in our membership that we work with on a daily basis. So yes, we're very in tune with what's going on there, and we provide a voice for a lot of our members to make sure that they're heard. With all the meaningful use coming out right now, everyone's concerned about what's going to actually be able to work, what can't work, and we're a way to get that word back to Washington about what's possible.
So you're basically working in between the two groups, those that are receiving the information and those that are generating it. Are you able to at all predict what's going on there and what may happen over the next year?
No, I wish I had a magic ball, but I don't. I think what we're finding is we're hearing a lot about things that can work, might work. There are a number of organizations that are concerned about meaningful use, and then there are a number of organizations that feel like they're ready and they're up for it. So it's going to be, it'll be interesting to see what unfolds over the next year. There's so much activity going on. There's a lot of money being poured into the industry right now. So it's going to be a great time to watch.
So what do you think are the critical issues facing hospital organizations today then?
I think some of the most important things that groups need to deal with right now are care coordination, patient engagement, privacy issues. There's a number of, just off the top of my head, those are three I think that are pretty important and groups are struggling with it on a daily basis.
You mentioned meaningful use, and one aspect of that is meaningfully interacting in a health information exchange.
That's right.
So are you involved with organizations that are trying to produce policies leading to standards that would actually allow that to happen?
We're actually the voice for Health Information Exchange. We do the annual survey of state, regional, and local health information exchange. We are in our 7th year of doing that. So we've been tracking these efforts for 7 years, monitoring their progress and seeing what works and doesn't work. We had over 200 organizations this year in actually 2009 in the last year respond to our survey. So we are pretty well in touch with what's going on out there and very anxious to see what happens this year in 2010.
What do you think is going to happen?
I think there's going to be a lot of growth. I think there are going to be a lot of folks who've gotten some money to do some exciting things, which is nice. We've struggled for a number of years to get attention and money and momentum, and I think we've got it right now. So that's a good thing.
So we seem to be at a tipping point, it sounds like.
Yes.
Do you think the technology has matured enough to be able to support large-scale information exchange?
Yeah, I mean, interestingly enough, I don't think it's the technology that's ever held us back. The technology exists there. It's usually policy issues, data sharing issues that are the biggest barriers, and privacy, of course,
sure.
To many of these things.